Judith Tintinalli. I guess you know my name from the book. Don is one of our senior editors as well. And I'm going to focus more on clinical work because that's really my main love. Now, I was a department chairman, started up the department at the University of North Carolina. I was chairman for 17 years. And I look back today, where did the time go? And how did I manage to do that for 17 years? I don't know, but I did. And I'm still very happy as I've transitioned out to be a clinician, a teacher, dabble in a little research here and there. But what I'd like to know is something from you, because I'm going to talk more about clinical emergency medicine. You can all hear me? Yes? How many people here have been in practice for 10 years or more? Lots. Okay. I'd like to hear from some of you what you think the changes are now that you didn't have 10 years. I guess the people in the front are going to have to start. And you can't say epic. It's got to be more than that. Any other people brave enough to say? That is true.
Revenues.
Yeah. Any other things? Let's hear some other ideas. Yes?
A ton more scrutiny.
Scrutiny, revenues. Some other comments. More regulatory stuff. One more comment from the audience. Okay, that actually was none of the things I was thinking of. I will say, when I was chairman, it was a very golden era for me, both at the University of North Carolina and I think in academic emergency medicine. I had full control over the money. Nobody took it. The dean took a little bit. Nobody cared who I hired, what I paid them, or how much they worked. Those times are gone, at any rate. But to me, the biggest change in emergency medicine has occurred to me in the last 8 years. I don't know why I picked 8. I guess because this is 2018. And the scope and the depth of what we practice has changed. We have digital resources to make us better clinicians. Yes, we do have a lot of scrutiny, but I don't know. I guess to me, that's not quite as important as the other things that have led to the emergency medicine where we are now. We've actually met all of our goals. We have a specialty, we have departments, we have faculty, we have research. We've really done a wonderful job. So that actually was my first slide, which was a bunch of people looking at patients with their iPhones. And another way that our work has changed is we have digital resources. I can't live without them. I have to pull up the heart score. I pull up the NIH stroke scale, and I follow all that, so it's made me a better clinician. But the thing is, do digital resources make an emergency physician? No way. Digital resources help us sometimes with diagnostic testing. They help us with treatment plans. What is the dose of medication? When do I give the medication? But they don't really make a doctor. So how do we learn to really make a doctor? It's not going to be through digital resources. I can talk about the Tintinalli book now, and we can just get it out of the way so people don't have to ask me, do we still need books? Yes, we do, because they're the foundation, the building block of everything. And if you go to Lithuania, if you go to Poland, if you go to Norway or Sweden, they're like, what is emergency medicine? You can sort of hand them something concrete and say, this is what we are. This is the scope and the depth of our practice now. How else do we learn? We learn from blogs and posts. Are there any bloggers here in the audience, people who write their own blogs? So how many people here use blogs for their own learning or research? Not as many as I really thought. But I find we now have a regular kind of feature, at least with the access stuff that I've gotten into, which is we have a series of the best blogs. I call it Bob, Best of the Blogs. And I've learned a lot. If I want to learn about new hot topics, you go and you look at a blogger. And that's, of course, what our residents are using. Every day I'll go on shift and they will say to me, this is what Scott Weingart said yesterday, and I better be up on it. Okay, that's emergency medicine today. This is what emergency medicine is if you're just simply an internet doctor. And this is what we're learning for our career now. So we have books, blogs, posts. What about journals? And we have many individuals here who are involved in many of the journals of emergency medicine or the other general journals. You know, when I was a resident or as a young faculty member, you would really make your mark by quoting articles that you read in the literature. Have you had residents do that? It's like they never do that anymore. So the role of journals is sort of diminished in the way we work academically. And this is why we rely on blogs, because they are simply, the people who write them are data abstractors for us. So I guess we've got a lot of different ways that we're learning emergency medicine now. And of course that involves teaching emergency medicine. But I'll get you to the bottom line. Emergency medicine is a contact sport. It's a body contact sport. And no matter what level you're in, you can't do it unless you're in the ED. You can't teach it from an armchair. And as most of us are clinicians now, and we love being clinicians, that's how we keep lighting the fire for our specialty and how we create a vision of the future and people to create our specialty and recreate it in the future. It's by being good clinical teachers. And that's it. Thank you.